Good morning, everybody. Thanks for being here today. As they just said, I'm Bobby Joawi, the Director of Employer Strategy and Solutions here at the Alliance. It's an honor for me to welcome you here this morning to our 2025 Spring Symposium. We're here today to tackle a pretty tough issue, one of the biggest challenges in healthcare today, bending the medical cost trend and lowering healthcare costs. But before we dive in, I want to take a moment to extend my deep appreciation to everybody here in this room. Our self-funded employers, our advisors, providers, industry partners, and of course our board of directors who have all joined us here today. Your willingness to collaborate, share ideas, and take action is exactly what we need to reshape the healthcare landscape. I also want to extend a special thank you to those who attended and participated in our data workshop yesterday. We explored the power of data and how it can contribute to bending the medical cost trend and rising healthcare costs. And for those of you who were able to join us last night at our welcome reception, I hope you enjoyed the evening and were able to connect, exchange ideas, and strengthen some of your partnerships. This year's theme, Bend the Trend, isn't just a slogan. It truly is one of our company-wide strategic initiatives. And we're focused on redesigning how we pay for and deliver healthcare. For years, the trend has been going in the same direction, up. Costs continue to rise, and we're at a point now where it truly is unsustainable. We can't leave it for our next generation to fix. I definitely don't want to leave it for my kids to fix. The good news is we don't have to, and we can start today. By working together, employers, advisors, providers, and industry partners, together with everyone in this room, we can disrupt the cycle and drive meaningful change. Yesterday, we laid that groundwork in our data workshop, where we explored data-driven decisions that help employers take back control. And later this year, we'll be talking about how smart benefit design can lower costs without reducing access to care. And our goal in bending the trend truly isn't about cutting benefits. It's really about optimizing how we pay for care and ensuring every dollar that we spend delivers value. This really truly isn't just another industry conference. It really is a working session. Bending the trend isn't just about lowering costs. It's truly about redesigning the system that works best for our businesses, employees, and providers alike. There's much we can learn from each other. When you leave here today, my hope truly is that you go home with ideas to drive change within your organizations. The conversations and the connections in this room will help shape the future of healthcare affordability. So with that said, I'm sure you're ready to get started and not listen to me any longer. I'm going to invite you to direct your attention to the screens, please.
Everybody, to a person, would agree that healthcare is too expensive in the country. Whether you're a provider, a health system, a third-party administrator, an employer, or a patient, an advisor to the employers, we all know this. This is unsustainable, and we're handing this next generation a set of issues that they didn't create. The question is, who's going to be bold enough to step out and try to make something dramatically different happen? Someone's got to lead the way, and that's what the Alliance is intending to do. I want you to think differently about the way that you do your work so that we can improve dramatically the results, not just incrementally, but make big shifts. And that means that we need to concentrate on what we call our per member per month expense. And so we want to try to drive that number down as low as we can. We're talking about bending the trend of medical spend such that it becomes less of an increase to start. We get it down to some kind of a break even, no increase, and then we start to get that to a point where we're actually decreasing the cost overall. That's bending the trend. The best ideas come from all over. Whether you are a provider, a health system, a third-party administrator, an advisor to an employer yourself offering healthcare, or even employees, I want you to bring us your toughest problems, but I also want you to bring us your solutions. The Alliance over the last 35 years has been working towards this day, towards this moment, but now's the time.
And now is the time. Please join me in welcoming our President and CEO to the stage, Mr. Kurt Kubiak.
Thank you for the great introduction, Bobby Joe. I appreciate that very much.
Welcome.
It's great to see everybody. Thank you for joining us here today, making time out of your busy schedules to be with us, to help us celebrate. We're glad to have you. I'm excited to be here. This is the start of something, very special, and today is the day that we get to introduce conversations that we intend to have throughout the course of the year.
Absolutely.
And so I'm very excited about the lineup that we've got for you all today, the discussions that we're going to have, and like Bobby Joe said earlier, we're grateful to all of you for all the hard work and dedication that you've already put in to get us to this point. So we're very excited that our future looks bright working together with you all.
Absolutely.
Yeah, now first I want to take a look back and recognize where we are as an organization. So the Alliance is celebrating its 35th anniversary this year. How about that?
Something special.
It's something to celebrate. And we've gone through many different changes in leadership and personnel and different ideas that we've implemented over the course of those 35 years to try to work on behalf of our self-insured employers. And so I want to recognize that the organization is in good standing and healthy because of all of the collaboration that we've had over the years from all of you. So thank you for that. And then we've also reached another interesting milestone, an exciting milestone. This year we crossed the threshold and we have over 500 employer partners with us. And so the number is impressive, but the number in and of itself isn't what's most important. Right? What's most important is that we now have the capability of delivering on the mission of the Alliance, which is to make healthcare more affordable. And so with the higher membership, with the number of resources that we've got that we can engage with, we can actually make bigger impacts in the marketplace, and that's what we intend to do.
Absolutely.
Yeah, so speaking of our mission, we're going to go ahead and get started today and show you all some of the things that we've been working on throughout the course of the year to bend the trend on the rising healthcare costs, and specifically this per member, per month expense. The other thing that we're going to talk about is doing that. So how do you reduce the costs while also increasing market share? Because these two things go hand in hand. We've got to be able to increase our influence, but then also increase the way that we're managing costs on behalf of those employers so that we can expand the geographic reach and also the mission of the organization.
And how we help employers and their brokers.
Entirely right. Yeah, we are here to support. So we'll take a look at some of the things that we've done over the last year. But I also want to make sure that everybody well understands, as we do, that we're hardly thinking that we've solved the problem. We are making a dent in the universe, and we're looking to continue this conversation, which is going to take years to fix. It's taken us years to get here, and we're going to take that time, determination, and focused energy to walk our way out of these issues. But we've got that determination, and we're excited to do that.
Yes.
So with that, I'd say today is that opportunity. Today's the opportunity to innovate. Today's the opportunity to collaborate. And it's through innovation and collaboration that we will together become stronger. And this mission is larger than any one of our organizations. None of us individually, none of our organizations individually can solve the issues that we're talking about today. But collectively, I know that we've got the brain power in this room to make a difference. We will make positive change happen, and we're going to do that together. So one of the ways that we're going to do that is by sharing ideas. All good initiatives start with an idea. And so we'd love to hear from you all today and collaborate with you as we work with the folks that are members of the coalition, the collaborative, as well as all of our partners. So whether you're a provider, a TPA, client advisor, we all know that you're on the front lines every day interacting with the healthcare system. You see the opportunities for improvement. You understand the barriers to getting things better. Please today take the time and give us your ideas. Share with us with that QR code your thoughts and your ambitions, and let's see what we can do together to make things better.
Absolutely. Share some of those actionable items that you think we need to hear about.
And so as you listen to some of the ideas that we share, I want you to work on understanding, what you're hearing from others that are giving us their ideas. But then think about how some of these brainstorming sessions you've been in historically have operated. where it's not necessarily, the first idea that comes out that's ultimately the idea that gets implemented. And so there isn't any idea too large or too small, nothing too far-fetched. So if it's in your mind, let it out, because there might be somebody else in the audience here that's willing to build on that idea, to offer something else that is tangential to that ultimately becomes the answer to the question that we're looking to solve, right? So please, by all means, be liberal with your ideas and please participate today. It's going to make the day a whole lot more fun.
Yeah, no answer is wrong, that's for sure. We found that out.
Very good. So, Bobby Joe, you and I know that we have been working over the course of the year with our leadership team, but also our entire team at the Alliance, to try to figure out how we can improve the healthcare space. And so we've talked to a lot of employers, and the message is clear. They are upset. They are frustrated.
Yes.
These issues notably are complex. As I said, it's far more difficult than any one of us can even understand, let alone solve for. And so we've taken down some of those ideas. Thank you for sharing those with us over the course of the year. But I think you'll agree that we can't simply talk about the problem.
No, we need action.
We've got to do something about it, right? And so it's one thing to have great ideas. It's quite another to take those ideas and turn them into something tangible, turn them into something actionable. And we're going to talk about the way that we've done that today.
We are. And we're not just going to stand up here and tell you about it and what needs to be changed. We're going to actually show you what we've done to get there.
That's perfect. So why don't we jump into it? So,
that sounds good.
Yeah, we've got 3 key topics that we're going to talk about. The first one is the one that we're calling, bend the trend. You've heard, our awesome music and the message about how do we make sure that we are focused on the right initiative, which is bringing the cost of healthcare down in its entirety. Not unit cost, but total cost, right? And we are laser focused on that mission, and we are determined to be dedicated to that long term. So this isn't a 1-month initiative. It's not a 1-year initiative. This is a multi-year initiative.
Absolutely.
Yeah, that we know we're going to need to engage all of you in these discussions to make these things come to life. So we're excited about the bend the trend. And then secondly, we're going to talk a little bit further about our preferred value provider list.
Yeah, something a little near and dear to my heart and our network team's heart.
You know this very well,
Yes.
right? So we've worked hard to create this list. So these are groups, of course, that are looking to save us money that we can refer to, that are going to provide opportunities, for you all as employers, you all as providers to give access to affordable health care.
Absolutely.
And then we get to number 3, which is our Find a Doc tool. We've made some enhancements to it. So it's not good enough just to have access to the preferred value providers. We need to know how it is we're going to find them.
Yes. And how do we direct employees to the right providers at the right time?
So the Find a Doc solution, we're going to talk a little bit about that, and we'll get into some of the screenshots, right, as to how that's going to work. And so each of these initiatives, none of them individually is going to accomplish the objective. We understand that. But collectively, it gets us closer to bending that trend. And so you're going to hear a sneak peek into some of the things that we're working on at the Alliance to try to bend that medical cost trend.
Yeah, and some unique ways that some of our employers have already started to do so.
Yeah, so Bobby Joe, over to you to just give us an idea as to how the audience can help us participate today.
So if you do have questions, please jot those down. Any thoughts or questions, you can text those to the number up on the screen, the 608-616-9920, and we'll address as many of those as we have time for as we're going through our slides.
Excellent. Yeah, the more interactive this is, the more productive it's going to be, and the better you all are going to feel walking out of here at the end of the day that we've addressed your issues and that we're doing something positive to make change happen here and now. So we all know that healthcare costs are rising, and the trend is working against us, right? If we do nothing, we've seen what happens, right? This becomes an up and to the right curve where things become more expensive year on year. And we know the power of compound interest, right? So those increases that occur in year 1 increase exponentially in year 10, and we've experienced now 20 years of those cost escalations. We've got to do something to disrupt that. Many of you have seen the RAND study that has come out that shows Wisconsin as the 5th highest state in the nation in terms of healthcare cost. That is not a spot that we want to stay in.
No.
We're not proud to be there, but we're not going to stay there.
Right.
And we're going to find ways that we can get ourselves out of that position. Those of you that are with us from Illinois, your facility fees happen to put you in the 32nd, so you rank better, but there's still work to be done. And so we're working with our folks and our teammate members in that Illinois market as well. But when it comes to the Wisconsin workforce, the issues with cost can be detrimental to the individual, right? It could be a case where cost delays care, and little issues become larger issues.
And we see it a lot.
Right? So all of a sudden now I don't make the visit because I don't think it's critically important, and then it turns into something that is, a larger issue, and it ultimately ends up a higher cost when you ultimately look to get the care provided.
Yeah, or something that could have been prevented long before.
Right? So the least expensive healthcare is the healthcare that you don't buy at all.
Exactly.
Right? So that it needs to be part of the solution. So we have launched this company-wide initiative that we talked about, but I also want to impress upon you all that this is a statewide initiative for us. The Alliance intends to be statewide here in the next couple of years. And we know that employer groups need us to be statewide. That's our desire as well. We know there are provider groups that want us to be statewide, and so that's the ambition. Yes. And so look for that to come as part of the movement in terms of reducing that cost and expanding our geographic reach. And the reduction in PMPM, right, that per member per month, I want to also emphasize the fact that we're not doing the same old stuff that's been tried before. This doesn't mean cutting corners on delivering healthcare. This doesn't mean denying healthcare to individuals, right? That isn't a way to truly bend the trend. That is delaying the inevitable.
Exactly.
Right? So what we want to do here is reverse that number. So we talked a little bit about it in the video, but I want to reinforce it here because it's so important to understand. We know that we're not going to be able to turn this trend on a dime. We know that the inertia is very strong and that we're first going to have to try to reduce the increases. That's the first objective. The second is to get us to break even. We don't want to just know that we don't have any increases year on year, that we're holding our own. Mm-hmm. But finally, every other industry has been challenged with tasks just like this, and they have actually reduced the cost of delivery of their services and their goods and services. So we need to be following suit.
Yes.
Challenge our ways, challenge the axioms.
Yeah.
What is it we can do differently to drive those healthcare costs down? And I know that sounds ambitious. It is by design. And the only way we're going to get it done is with the thoughts, ideas, and execution of this group that we've got gathered here today. So again, thank you for being here with us. So unless you've got a clinic on site or a near site clinic, a lot of times when a patient goes to see a provider, they're given direction as to where to go following that visit that is medically correct, but doesn't always include all of the information that a patient might need.
Absolutely.
Now, one of those items is cost, right? So we don't always talk about what is that next visit going to cost, right? When I'm looking to get engaged with a specialty provider after a primary care visit, for example, right? And again, employees, they're just trying to get better. They just want to know that they're going to get back in the workforce, get back to their families, and get back to life. And so what is it we can do to make sure that they are choosing among those options that are going to be best, not only for themselves, but also for the employer and for the providers that are willing to lean out and lend their time, talent, and service to provide better access to high quality, well-cost managed care, right? So we need to take a different approach to lower that PMPM.
We do.
And it's got to be disruptive.
Yep.
So Bobby Joe, we talked a little bit about what we can do next, and I'm looking forward to having you take us through a little bit of how we can put this plan into action.
Yeah, like really, what can we do differently? What can you do differently? It really comes down to our preferred value providers. So you might say, oh, okay, we heard a little bit about that yesterday if you were at the data workshop. But it's really one of our initiatives is how do we operationalize that? How do we work with our employers to make that meaningful? And that's really working with employers and TPAs to incorporate our preferred value providers into your benefit plan design. It doesn't have to be drastic, and you can, incrementally make changes to your benefit plan to provide meaningful impact to that. By incorporating our preferred value providers, or what you'll hear us referencing as PVPs, into plan design, you can either do that through benefit tiering, or you can do that through steering, utilizing incentives. So you steer employees to go where the care is good, costs are low. It leads to savings not only for that employee, but also for the employer. And for those employees, when they realize that they can go someplace and the cost is low, or there's zero cost, or that they actually get an incentive for utilizing services that they would they need, they're more likely to use that care, and they're more likely to step outside the hospital system. But the key to that really is the education and engaging those employees, because without that, there is no plan design that is truly going to impact healthcare. So we know employers provide amazing benefits. We have amazing benefits here at the Alliance. I'm very thankful for that. Because we also know that, your employees and health and well-being is really key. They're your most valuable asset. So giving employees those great benefits, helping them understand how to actually use them, and working with the Alliance and our employers, we can make a huge impact moving forward. So maybe just a quick little side story. All of the Alliance employees know all about this because we hear about it. It's pretty fantastic. We actually have an employee that talks about how through her benefit plan, we have a couple of benefit plans here at the Alliance, which I'm sure some of you know because we're very happy to share what we're doing. Like I've said before, we don't just talk the talk, we do walk the walk. So we are utilizing the benefit plans we're talking about today. But we have a plan that's a $0 copay plan, and then we also have another one that just offers incentives, great incentives, by the way. But this particular employee kind of makes a game out of it, like how can I get to zero cost and not pay anything? So in 2024, she did just that. She paid nothing out of pocket. It's amazing that she was able to find the care that she needed when she needed it, and she paid nothing beyond her premium. So it did take a little bit extra work. Nothing we're talking about today is easy, but that's why you're all here. Healthcare is not easy, but we will help you through that. But she did save a lot of money on the back end, so her work was very meaningful. It's a win-win.
One of the neat parts about this, right? So we have weekly meetings, we talk about wins, and employees share the fact that they were able to see healthcare providers at zero cost.
Yes.
Right? And so you as employers, you're trying to understand, well, how do I get the word out to my employees? How do I make an impact that they can understand and make sure that they remember to use these services that are set up for them? Have some kind of a weekly session or a regular time session, whether it's monthly, that might be well enough. But make sure that you're sharing those success stories because employees relate to one another. So when we talk about this zero medical cost for an entire year, there are people that are energized within our own staff that want to emulate that.
Absolutely. And when you have employees that are doing this, out on the floor, in your office cubicles, they're talking about this. I mean, they are the best word of mouth and advertising that we could ask for. So it does, if they've had a great experience, that is shared internally.
That's it.
Yeah. Yes. So we actually have a couple of employers that have done this, and one of them, a manufacturing employer, adopted a benefit plan design similar to what we have for 2024. And in that 1 year, which was a drastic change to their benefit plan, they saved over $95,000 in 1 year by just on the PVP steerage that they had in place. So steering to those PVPs for colonoscopies, diagnostic imaging, and MSK procedures over where they could have gone to the health system and had those services, that's significant. They had 64 episodes of care, individual episodes of care, just in that first year of utilizing that tiered plan design. So
those are big cost savings.
A huge cost savings.
Right, over a limited number of procedures. So awesome for them, excited that they were able to do that. How did the other employers in the room decide how can I take and participate in that same level of activity? What kinds of actions can they take?
Absolutely. Well, so we've kind of made it a little bit easy for you. I mean, we'll have conversations with you. We'll talk to you about our benefit plan. It's easy to even implement some of those changes today. Just notify, not even implementing, it's what we have available. Our Find a Doc tool already includes our preferred value providers. What we've done is we've created an enhancement where we have created an icon for our PVPs. So you can go out to our preferred Find a Doctor tool, search for providers, and that little icon will be there next to all of our preferred value providers. It's a huge win for employees in understanding where to go and who to go to, and easy for them to utilize. And it's a great way to show employees who these providers are, because they truly do offer best costs for these steerable procedures. And again, like I said, it's for diagnostic imaging, colonoscopies, MSK, some dermatology procedures, things like that. But we have, I think, over 55 steerable procedures that we utilize in order to recognize these preferred value providers. So we've turned that on for all of our employers, except for a handful, because we do have some employers that have custom preferred value provider lists, and they've chosen not to include that icon, but today it is available for use. And the other thing that we also allow our employers to do, if they have made the decision to utilize a tiered plan design, that information's in our Find a Doc tool today as well. So if you have a tiered plan design and you've got maybe a 3-tier plan, employees are able to search for a provider, and it'll tell them specifically whether or not that provider is a tier 1, tier 2, or tier 3.
So great resource.
Huge,
right?
Great resource.
That we are putting the power in the hands of the employers, putting the power back in the hands of the employees, right?
Absolutely.
To make those decisions with meaningful data.
Yes.
And those exist today.
Today, yes.
Excellent.
So maybe a great example of this is one of our employers, Crystal Finishing, they implemented this preferred value provider plan, benefit plan, and this is what it looks like out on their Find a Doc. So it does include the circle with the star, that's the preferred value provider designation, along with the tiering. You'll see that in the corner. And then for Growmark, this is just an example of a group that doesn't have tiering but has the PVP iconography. And again, you can click on the icon and it'll give you the definition of what a PVP is. So we're very excited about this. Hope that more care is moved to these great preferred value providers. And the great thing about our PVPs is the fact that it isn't just a stagnant list. That list grows monthly. We're adding providers to that continually as we evaluate providers coming into the network, our providers that are already in the network, but they're reevaluated every year.
Right. So again, in terms of participation, if you are aware of a provider that you would like to have on that preferred value provider list, get that to your account executive. Let them know what that is so that we can bring that information back to us internally, take a look at what it might take to get them on that list. If you are a provider yourself and you're interested in being on the list, get a hold of us. Make sure that we talk through that with you so that we get you on that list in the event that you qualify and as soon as we can make those changes.
Absolutely.
Yeah.
Great. So why don't we kind of kick this off a little bit to our audience and see if you guys have any questions.
The first question I got from the audience is, why is Wisconsin the 5th most expensive state? And what are some of those contributing factors?
Sure. So the RAND study bifurcates the costs into facility fees and professional fees, and the 5th ranking is related to facility fees specifically. When it comes to professional fees, Wisconsin actually ranks number 1.
Yes.
In the nation in terms of professional fees. Now again, this is all health system data, and it's as compiled by the RAND study. So it's the facility fees that I was referring to. Great question.
Yeah.
I think so. Yeah. Good morning. I have a question about the portal utilization. Have we surveyed or demoed this with actual employees?
The Find a Doctor tool?
Yes.
Yes. I mean, the Find a Doc tool has been available to our employees for years, to employers and employees alike for years. The new enhancements are new within this last year. Does that help answer your question?
Yes.
But we are always looking for input, though, on how we can make that tool better.
Just wondering about the generalized feedback as to the easiness, or if it's user-friendly, what kind of feedback and input have the employees, because they're the ones really utilizing this.
Yes. We do monitor on a monthly basis and get feedback Like, how many hits do we have? How many people are actually doing searches? What are they searching for? Things like that. And there is a little survey box on the screen too. So if you do have feedback, you can actually click on the box on the Find a Doc tool and provide some input. But we here at the Alliance would love to hear from employees or employers. So if you as an employer hear feedback from your employees, we would love to hear it as well and share that information with us.
Thank you.
Thank you.
Yeah, one of the ways that we want to impress upon you all to improve our systems is that close feedback loop. So when we launch something, we believe we've got it right, but if you are interacting with it and you don't feel like we've got it just right, the faster you can get that information back to us, the faster we can react to that and ensure that we don't confuse employees or that we don't have any miscommunication. So excellent point that you've made. I appreciate that question.
Yes, thank you.
Hey, I have a question for you. So, Kurt, Bruce White, Schwartz Insurance. So, first, I guess I'd just like to compliment Kurt. I deal with medical providers quite a bit, and Kurt's done a great job in the last year really repairing relationships and making it a positive experience with the Alliance. But my question for you is on that preferred value provider. So, when you have the list and you're directing members to go to those locations, do you also reach out to those local providers to make them aware of the cost differences and try to drive that to that community rather than driving it to a farther away facility?
Oh, you're talking about our providers that may not be preferred value providers today and having those conversations? Is that part of the question? I just want to make sure.
Yeah, my question is to not drive it out of the community, to take it to a different location. I mean, in most of these communities, the small communities, if a hospital isn't there, these businesses are probably not going to be there.
Right, right.
Yeah, so I would say one of the really positive things that we've experienced in my short tenure with the organization, coming up on a year here in June, is that the providers have reached out to us and are looking to collaborate. And in particular, I know there's providers in your area, Bruce, that have said, I want to participate in that preferred value provider opportunity. And they are on that list. So we are able to include health systems in that preferred value provider listing. And we are able to steer to those organizations that have demonstrated a commitment to that access to high quality, lower cost healthcare.
Yes.
So there are ways that we can collaborate. And again, I want to be all inclusive here. If we're going to solve this problem, it's going to take providers and payers and employers all getting around the table on the same side and figuring out how it is we can improve access, improve quality, and reduce cost. But it's got to be by design.
Yes.
Hi, so Sabina Singh with Innovia Health Primary Care. Same kind of question along the preferred provider networks that you have. As primary care, how do we access this portal so when we have the patient in front of us, we can make the right referral or at least work through it? Because that's going to help with the steerage probably more than anything else.
Absolutely.
And then how do we follow up with the referral going to the right place? So I don't know if that's been discussed, and we can talk privately if there's a lot of detail behind it, but just want to make sure that we're included in that.
Very easy for you because everybody can access the Find a Doc tool. The nice part is that one thing that we do is, as we talked about, is the directories are built for our employees. So each employee has their own directory or directories depending on how many benefit plans that they have. So you're actually able to just come to our website, click on the Find a Doc icon, and then you're able to type in the city where you want to look, as well as the provider name or the employer name, and that will appear, and then you can go right into their directory and search. Yep. And, Sabina, since you had asked the question, the one thing that I didn't talk about when it came to the preferred value providers is we're up here talking about diagnostic imaging, colonoscopies, providers that do provide MSK procedures, but primary care providers are also included in that. We do have independent primary care providers on our PVP list, as well as a employer direct primary care provider, such as yourself. Innovia is on our list. So it's about creating partnerships with those direct primary care clinics, on-site, near-site clinics, because quite honestly, without those partnerships, we need them in order to have patients directed to care, to preferred value providers. I mean, primary care is extremely important in making sure they're getting the care they need and directing and referring patients appropriately. So thank you. But I could also walk you through that too.
I'm getting a lot of questions from the audience asking about the criteria for the preferred value providers, how people get on the list, if we've seen ROI from that, and independent primary care options. So can you talk a little bit more about those?
Sure. So if we have providers within the network and you're interested in becoming a preferred value provider, we would most definitely love to have a conversation with you. We do have specific criteria based on cost and where a preferred value provider is in relation to maybe the rest of our network. So there's some criteria that we take a look at and that we work with our networking team to determine, as well as our analytics team. So it's not just well, they look like a good provider, we'll add them to the list. We do actually have specific criteria. We're also happy to talk with providers to let them know what they need to do in order to get there, because that is extremely important. What was the other part of the question, Jennifer? Sorry.
That's okay. I lumped a bunch of questions together. We have an engaged audience, which is great.
Yes, which is awesome.
There were questions about independent primary care and direct primary care and how that interacts with our PVP list.
Yes, and that's what I was just alluding to. So maybe you are a direct primary care provider, an independent primary care provider that contracts direct with employers. If we share our PVP lists with those clinics, we are excited to share those lists with those clinics to make sure that they're referring patients accordingly, or also for those employers that have tiered benefit designs that are tiering to our preferred value providers, or even our premier networks. We want to make sure that those independent primary care clinics and direct primary care clinics have the information they need to care for their patients.
What I'm also hearing potentially is that even though we're making these lists available and we believe that the lists are fairly easy to navigate, maybe folks are interested in having us take them through a tutorial.
Yes.
As to how that works,
Yes.
whether I'm a provider
Yep.
or
And I would
whether
love
I'm
to
an
do that.
employer. So if you've got that idea that, gosh, I understand what you've said, I see the iconography, I understand that there's a list, but I really want to understand how do I access it personally? How do I navigate it? Would you mind coming and showing me?
I would love to do that, or our account executives would also love to be able to do that when it comes to their employers. They can do that, but I would love to show providers how they use the tool as well. So.
Yeah, I think that's critically important feedback, right? So again, we heard from one of the employers saying, well, gosh, my employees maybe aren't navigating that tool as easily as they think they should be able to. That's important feedback to get to us. We can pay you a visit. We can even do an online meeting or intervention. And then with our provider groups the same way.
Right, and we have some wonderful marketing materials too on how to actually use the tool that we would love to be able to share with you too.
Great suggestions.
I have an additional compliment and question. So one is the compliment. Somebody had asked about the primary care providers being able to use the tool. That's actually some feedback that our group has gotten from our employees and actually their families, because with 17 different vendors that we have partnerships with, when we direct them out to a website to log in to find something, one of the obstacles or challenges they face is, I don't remember my user ID, I have to reset my password, now I have to wait for the multi-factor authentication to happen, right? And you're sitting in the doctor's office. But the reality is on the Alliance website, it's all you have to know is the company's name that insures you, and anybody can look that up. So you go to the website, you know that your family member has the coverage through the Alliance, you type in the employer's name, and that's how it comes up. So a compliment to you. I've gotten a lot of feedback, especially from employees' families who are trying to access it but don't necessarily realize that they don't need a login. The question I have is a little bit of a follow-up to the one that Jennifer had asked about the preferred value providers. One of the initial pieces of feedback that I had gotten as we rolled this out was, how do we know that you're not sending us to a low-cost chop shop? Right? Speaking to quality, we're talking a lot about cost and how we rank our providers with relation to cost, but what is that reassurance that as we engage with these high-quality providers, or preferred value providers, we're talking high quality or better outcomes in addition to lower cost?
Sure. Well, I could tell you one thing, we wouldn't send you to a chop shop for sure. But thank you, Diana. Yes, absolutely. But when we take a look at our preferred value providers, we're also looking at providers that have actually provided these services, and they have provided several of these services. They've done hundreds of knee surgeries. They've done shoulder surgeries. These are providers that have been in our network, that our network team and credentialing team have vetted and know history and the types of services they're providing. It isn't the guy that's doing the knee surgery out of the trunk of their car at the garage, for sure. Yes, most definitely.
Yeah, and healthcare quality, we understand, is an important initiative. It's a strategic initiative for the Alliance as well. It's on our list of things that we're looking to tackle. It is a very complex and difficult thing to try to find a balance between information that we can make readily available to employers and their employees, but also that is not burdensome on a group of providers, right? Because every payer has their own criteria that they're asking for providers to comply with. And what I've heard from provider groups is, I can't do another version of that. It's too difficult. So we are looking at trying to consolidate with a Medicare-based plan. And so we're working hard on that. There are challenges with it, but we think that that's probably the most easy stepping off point for us to be able to deliver that at some point here in the relatively near future. But that's a great question, Diane, and I appreciate you making mention of it.
And thank you for the compliment too. We do appreciate, and that's the whole focus, is to make that an easier tool for everybody to use.
And though I'm supposed to be asking questions and not answering them, the RAND hospital study actually states that there is no correlation between cost and quality. And so we do look at that information as well. How customizable is the provider search tool? Are you able to add in on-site clinics so that it's a full steerage search tool?
Great question. And today, if a provider's not part of the network, they're not included in the tool, but it is definitely something that we could take a look at and consider.
I like the idea. Capture it.
Yes.
Do you have any virtual or digital care options offered as a PVP? And do you recommend specific companies that provide on-site and near-site clinics to your customers who are looking to lower costs?
Oh, great questions. Yes, we do have a virtual primary care provider, ACOSMD, which is part of the network, that is available to all of our employers, regardless of whether you're utilizing tiered plan designs, to our PVPs. In our preferred value provider list actually does include an entire list of the partnerships we've built with independent direct primary care practices, as well as on-site, near-site partnerships that we have with different providers throughout the state. So if anybody is interested, please feel free to reach out to your account executive. They can share that list with you. And if you know about an independent direct primary care practice that we may not have on the list, please let me know, because we would love to add them. We are adding providers to that list all the time, and we want to know about new direct primary care practices that are popping up throughout the state and in Illinois.
Yeah, great point.
All right, well.
Any other questions?
Whoa. I'm going to throw my cards at you. I'm so excited.
I was ready to catch.
Yeah, thank you.
All right. So moving on here, as we come to a close, right, this portion of our presentation, I want to emphasize that we're at a crossroads, and we've got to make a decision. And every one of us individually has to make that decision as to, are we going to continue to allow things to go as they have gone, unchecked, unfettered, and have costs increase beyond what is reasonable and sustainable? Or are we going to take action? Are we going to take control and steer down this road of lower cost solutions, higher quality solutions, easier to access solutions? We've got to make that determination, and we've got to make that now. And you now have access to tools that we just talked about that you can help to make those things a reality. So use those enhanced navigation tools, use that PVP list, update it as we talked about, great feedback from the audience. But we've got to change the way healthcare is consumed if we're going to make a difference. And again, trying to bring together these relationships, I want there to be this collaboration. I can tell you I was so excited when we had our reception last night that it was represented by providers and payers and advisors and employers, CFOs and HR folks that were having conversations about what healthcare costs mean to them, how they want to participate, and how they were excited about this event. And so this is the time, now is the opportunity for us to be able to make change happen. And so I want to make sure that we're, again, emphasizing that fact that we want to hear from you today. But bringing together the relationships is going to be how we make this work.
Absolutely.
Right? We can punch far above our weight when we've got other groups that are standing with us.
Yes.
And taking a stand to make that happen.
Can we ask a couple more questions? I'm still getting them in from the audience.
Of course.
Sure.
I'll be here as long as they've got questions.
What is the turnover rate year to year of PVP providers? Are these multi-year contracts with these providers so members aren't consistently having to change doctors?
Yes. They aren't turning over from our PVP list because, again, our preferred value providers are part of our network. So everybody has access to them. It's a matter of whether or not you decide to tier or steer to them. But you do have access to them. We have not had turnover in our PVP list unless the practice itself is maybe closed or something like that from a primary care standpoint. But other than that, we do reevaluate, but they aren't falling off the list or going in and out of network.
How is the Alliance working with the large hospitals to get them to hear employers and patients and help make these changes?
Well, I think we're going to maybe talk about this a little bit later too, but what we've seen happen is that our preferred value provider lists have actually, that information has gotten to the hospitals, and they are now actually coming to the table and wanting to work with us to become a preferred value provider, which is very exciting because years ago when we started this, the thought process is that we need to keep care out of the health systems because it is more expensive. But now they're actually coming to the table and saying, hey, we want to be this option. We want to have these employees coming to our hospital for care. And we just very recently added our first hospital to our PVP list. So we're very excited about that.
Yeah, one of the things that I started with was a listening session when I got to Madison here, and I met with health systems of all sizes. And the encouraging thing for me was a recognition for the first time in the couple decades that I've been involved in this industry that there's a problem that they're a part of. And they've all said, we know that we can't continue to put costs up on our employer partners every year for the next 5 years. That's not gonna work for us either. And so they are realizing that they're necessary to be part of the solution.
Absolutely.
And as Bobby Joe said, we've got some folks, you can imagine, right? There's a spectrum of engagement. Some folks are saying, hey, I'm ready right now. What do I need to do? I'm ready to engage. Others are saying, I'll take a wait and see approach. I understand your message. I see how it might work, but I'll let somebody else go first. I think that's probably the way that most change happens in any industry. So our ears are open, we're paying attention, we're listening. If there's a system that you want to know specifically about, I'd be happy to have that conversation, or our contracting team, Deb Comferman and her team would be happy to have that conversation with you. But we're having regular conversations all the time with health systems about different ways that they can participate in these initiatives that we are embarking on. So again, trying to be totally collaborative.
The Alliance, with their PVPs, has a nice solution related to small and mid-tier health plan costs. That said, we know that healthcare costs are greatly influenced by the large claims. What solutions have been truly working for the large claims that are generally being serviced at major hospital systems that continue to increase their prices?
Yeah, I'll tell you, that's one that I would need a little more specificity on it to be able to speak to it intelligently. We will talk later about groups that are helping to manage high-cost claimants, and there are different reasons for those high-cost claimants' condition. And so to answer that intelligently, we really would need to understand what are the underlying factors that are contributing to that high-cost claimant's condition, and what are those solutions that are appropriate for that individual. I do know that employer groups are trying to figure that out. And so great question. There are answers. If you were to speak amongst the team that is here, the employer groups that are here, I'll guarantee that you'll get answers from at least some of us that have taken action to that question like we're talking about. But it's difficult for me to answer that one generally because I really need to understand the specifics of it.
What role is the Alliance taking to educate our elected officials on the real problems and how to change them?
Yeah, a very unique situation to the Alliance as it relates to other healthcare cooperatives across the country is that we have access to a legislative policy group called Advancing Free Market Healthcare. And we also participate as the Alliance ourselves in educating our legislators. But Melissa Duffy is here. She's going to be doing a breakout session later today on this exact topic. And so there are things that our employer groups can do that we need you to do, frankly, to get involved in some of the proposed legislation that's out there, even stuff that's out there actively today. Because some of these things sound good on the surface, but when you get to understand what the implications of some of these bills and initiatives are, they would become problematic for us. They would become problematic to ERISA, which is the foundation of a lot of the self-insured funding methodology. So yeah, we are actively involved in that space. We are actively talking to state representatives and state officials. We're also part of the National Alliance. So we've got representation in Washington, D.C., and we've taken the opportunity to go visit them in D.C. and also part of their roadshow that they host. Last year they were in Chicago. This year they're going to be in Dallas, but we participate with that national legislative and health policy group as well.
Thank you.
Is there a yearly cost increase from PVP providers, and if so, how much?
Yearly costs and what they're charging, or yearly costs from a access fee standpoint in the network? There is no additional charge to access our preferred value providers from a network access fee. It's just a standard solid access fee. If they're talking about rates, it depends upon the provider and what their contract terms state.
With PVPs being lower cost, what if I have a high deductible plan? What is my incentive to seek lower cost care, as it will take longer to meet the deductible, or if I know I will meet my deductible, I may not care about lower care options?
Yeah, that's where incentives can come in. So we have a number of employers that have maybe like a copay plan or a high deductible health plan. The Alliance ourselves, we have a zero cost Tier 1 plan, and then we also have that high deductible plan where we've implemented incentives. So you might have that deductible, but say you go to, you need a colonoscopy, and you go to one of our PVP providers on that high deductible health plan. There's an incentive payout. Maybe that's $250. Maybe that's $500. We have an employer that paid $750 for an incentive. So although you've got that high deductible health plan, there are incentives you can put in place to pay those employees then on the back end for seeking services from those PVPs and help out with that high deductible.
Yeah, so it's the tiering process, right? So these are
is.
going to be in Tier 1.
Yep.
And then this education and steering concept. Right?
Absolutely.
So back to the fundamentals of what we're trying to do to make things really easy and transparent.
Yes. Yep.
How can employers help with legislation and still keep a neutral political stand?
Yeah, what I would say is it is possible. Common sense is lacking in a lot of these discussions. And it doesn't make a difference whether it's the left written policy or right written policy. What we have to advocate for is what works. And where we find logistical problems in some of the legislation that's been written as it's been written. And so, again, we by design need to be able to operate in any environment. And so we aren't here to take a side. We're here to advocate on behalf of the employers that we represent and their employees. We're here to advocate on behalf of the provider groups that have demonstrated a commitment to our initiatives and wanting to improve the way that they deliver healthcare and making certain that they can operate as freely and routinely as a competitive market will allow. So those are the things that the Alliance stands for. Those are the things that we would advocate for. And it doesn't make a difference what party you are a part of in those conversations.
Why are you engaging with traditional hospital-based networks rather than building out the independent movement?
I was going to say, it really comes down to access. We need to make sure that we provide access to our employers and employees, and then create these back-end tools like our preferred value providers, engaging and partnering with independent and direct primary care practices to make sure that the access is there, because there are several independent physicians and that we want to partner with, that are part of our network, that we do partner with, but they can't provide all the care that's necessary for employees and patients.
Yeah, I mean, this goes all the way back to my opening remarks when I joined you on the stage today about the growth that we've seen amongst our employer groups and what their needs are. So they're far flung, right? These are statewide organizations that need support where they live. And so we've got to meet them where they are, which means we've got to be having conversations with provider groups in those areas. We've got to be having conversations with their partners, employer partners in those areas. And then by design, we are opening up our doors for business. The Alliance is open for business. We want to collaborate with you. And so we're going to have conversations at the same time. And I'm not going to predict, where these conversations might go or where we might find the best traction. I'm only going to let you know that we are dedicated and laser focused on reducing the PMPM. So I don't care if you're an employee making a decision about your personal health care, you're either going to raise the PMPM or reduce the PMPM with the decision you make on where you go to select your care. Whether you're a provider, you're making a decision on where those people are going to go. It's either going to raise or reduce the PMPM, right? It's a very consistent and integrated message. So we are all aligned.
Yes.
Right? So those are the reasons why we're so excited about what the future holds for us, because there are groups, as Bobby Joe said, that we couldn't have predicted are coming to the table and asking for a seat in these conversations, which we are thrilled about.
Absolutely.
There is a question about the Alliance having a statewide option.
So today we have a statewide option through a partnership that we've got with WPS, right? So and maybe you can even speak further about that, Bobby Joe.
Sure. So we have a couple of options. So we have a relationship with WPS that provides a statewide network for us, and we also have a relationship with Trilogy to help round out our network and provide a statewide solution. But we are, as the Alliance, looking at expanding our service area to include the entire state of Wisconsin, and we are in discussions with providers to help us fill that network's void. So we are excited about that. Do you have anything to add?
That was a perfect answer.
All right, great.
Great questions. This is an
These are great
excellently
questions.
engaged group. Thank you.
I think they just like to hear Kurt speak, so.
Do you have an ROI calculation for referrals to PVPs? I'm not exactly sure what this question means, but I thought I'd ask it in case you all did.
We do not. Now, I suppose I could probably ask our Director of Data Analytics, and I'm sure he could maybe come up with one.
So again, just again, to make sure that we're all on the same page with regard to the business speak, right? ROI, return on investment. So that's an interesting question in that there really, as Bobby Joe said, there isn't an investment that's made. So you've got access to the preferred value providers with the fees that you're already paying to be part of the network. So there is no ROI calculation per se. However, I think what the person might be getting at is there a cost savings report that you could generate?
And we do have that available.
Right? So maybe you can speak to that if you would.
Yes.
Just what kind of cost savings can we summarize for our employer partners and the benefit of using a preferred value provider? Can we quantify that in dollars?
Yes, we can. And we can do that through, if you were at our data workshop yesterday, Ryan Peterson walked through the analytics that we have available that we can provide. But we can provide that to you not only to show you what you saved after you've incorporated preferred value providers, but we can also show you what you could save if you incorporate preferred value providers into your plan and design. So if you're here today and you're interested in that and you weren't able to attend the data workshop yesterday, please reach out to your account executive and they will definitely help you walk through that and what we could run for you, help you understand where your utilization is going or where it could be going.
Yeah, we do have a great set of tools, and our capabilities are unique in the industry, and very excited. So the more data you would like, I think the happier we would be to deliver that, and we want to engage you in those conversations for sure.
Yes.
Okay, so what I want to talk about, now is a topic that came up in the Q&A just a little bit, but all of you that are employers, in the room, or business operators for that matter, whether you're an employer or not an employer, well, employers, business operators, all the same. You all are dealing with business problems every day that you have to manage. You're dealing with different costs that boil to the top that you need to address. No differently are these healthcare, spend items that boil to the top. If you were to look at a Pareto chart, there's going to be a small number of these things that make the biggest impact. And that's where we're trying to make the biggest difference, whether that is low volume, high value, or high volume, low value. Either way, total cost of care management is important to us. So what we want to do, again, is encourage a wide, diverse group of us to get together and have these conversations. So again, how do you bring together the employer, the TPA, the stop-loss carriers? We haven't talked about those guys yet, I don't think. And our advisors, right, to help deal with things like high-cost claimants. It's a real issue, and we want to be able to provide solutions, and none of us individually is going to be able to address those. So, here and now, we're talking about ways that we can collaborate in that regard. We know that the Alliance can't do it on our own. You as an employer are not going to be able to do it on your own, but together we will accomplish that. And our mission and our vision is to make that happen in real time as quickly as possible. So we're going to roll up our sleeves. We're going to get to work. We're going to engage you all in those conversations, and we'd love you to pull us into those conversations you're having as well. Right? But I do want to be clear about this. We are by no means putting a stake in the ground suggesting that we've solved anything. We believe that we've got solutions that can help, assist, get us to where we're going, but we by no means have we arrived anywhere yet, and we've got a steep hill to climb, but we're prepared to do it.
Yes. And we're looking at ways to do that too. We're looking for your input.
Okay, so once again, I'm going to encourage you all to use that QR code. Yes. And to get your ideas out in front of us, because again, I believe this firmly and definitively, the best ideas are going to be the ones that are out in the room. We can't possibly think of all the different things you've encountered in your travels and in your experience with regard to the healthcare system. So please give us your ideas. Make certain that you make good use of that code. And your collaboration is key to getting us on track, to figuring out how it is we can take on that next big topic that you all believe is most important, because what's important to you is important to us. And so with that, my commentary has come to an end.
Yeah, yes.
And I'm excited to have you all on the team and involved in these conversations, and I'm looking forward to having conversations with you all later today and into this afternoon, but then also throughout the course of the year. So again, thank you for your participation.
Absolutely. Yeah, thank you. We really are excited about what we can do together. So please come up and talk to us during intermissions, or talk to your account executives. Anybody here from the Alliance, please share your ideas.